Hi everyone, welcome back to my channel named PSM Made Easy. Today I shall talk on frequently asked questions on the national immunization schedule. Recently I did take a session on the updated national immunization schedule, which is practiced currently in across the country. So it will be good now to take certain questions or which can be asked, or which our health worker faces, the peculiar situation our health worker faces during vaccination. So let's try to have a proper understanding on few of the questions, important questions on national immunization schedule, right? Okay. So I'll start with the first question, and the first question is the easy one. So, at times people ask, why are vaccine administered at specific site on the body? Let's take an example of BCG. BCG, we know that it is given in left upper arm intradermal. So what's wrong if we give BCG in the right upper arm? Nothing wrong, but the program has been designed or envisaged in such a way that let's maintain uniformity, right? We need to maintain uniformity because this is basically our health workers is going to practice it, so it should be uniform, right? Now if you go to a house and you ask a mother that whether your child has been vaccinated, BCG has been given or not, so if she has a MCP card, she'll be able to tell you by seeing the card. But if she doesn't have the MCP card, so she'll not be able to figure out whether BCG was given or not. So if you are, then the next question happens that any vaccine at the time of birth was given in left arm. So she recalls and says, yes, injection was given in the left arm. So that is, we presume that is BCG. So just to maintain uniformity, vaccines have been designated, or it has been designed in such a way that give at specific site on the body, right? This is the first one. Okay, let's take the second question. The second question is, why should there be a minimum gap of 4 weeks between two doses of most vaccine? Students, we say that when we are giving two vaccines, the minimum gap should be 4 weeks, right? The purpose of that is to achieve the needed antibody production, which is required for optimum protection. So the minimum gap between two vaccines, mostly it is 4 weeks, right? If you reduce the time period, if you give the second dose of the vaccine less than 4 weeks, so the desired antibody production will be not there and the beneficiary will not be adequately protected. So it is important to maintain the gap between two vaccines at least 4 weeks in most of the cases, right? Okay, let's take the third question. Now, if a child is brought late for subsequent dose, right, should one restart with the first dose of vaccine? Now, the straightforward answer is, please remember, no, we don't need to restart. So first you should know that we don't need to restart. The second, we should know pick where left, right? Means, let's take an example which is given here. At 5 months of age, the child has already received BCG, pentavalent first dose, rotavirus, FIPV, PCV and OPV first dose. The child has already received. The next scheduled dose expected was 6 months, but the child has not turned up. The child came at 11 months of age. So now the question is, should we restart? As I said, no, you don't need to restart the vaccine. No need to repeat the vaccine. You have to pick where left. Now the child has already received Penta 1, so we'll give Penta 2, we'll give OPV 2, we'll give fractional IPV 2, we'll give PCV second dose, we'll give rotavirus vaccine second dose, and Measles Rubella first and GE wherever it is applicable, and vitamin A. So wherever we have stopped, or wherever we are left, we need to pick it from there. So one liner, we know we will not repeat the vaccine once given. Okay, let's take the next question. If a child who has never been vaccinated is brought at 9 completed months but before 12 completed months, so the child is in between 9 to 12 months, then can we give all the due vaccine? The answer is yes. Suppose let's take an example, 10-month-old child. So let's start thinking, can we give BCG? Yes, the answer is yes. Why? Because it is given till 1 year of age. Can we give hepatitis B birth dose? No, because it is given till 24 hours. Can we give OPV first dose? Yes, the answer is yes, because it is given till 5 years of age. Can we give PCV? Can we give pentavalent first doses? Can we give rotavirus vaccine? Can we give FIPV? The answer is yes, the first doses of all the vaccine, because it is given till 1 year of age, right? Now at 10 months, at 9 to 12 months, the scheduled dose of measles rubella will be given the first dose. The scheduled dose of JE will be also given the first dose, and will also give vitamin A. All this vaccine can be given on the same session, at the same session site to the beneficiary. If you're giving more than one vaccine in one limb, for example, in this situation, there is a possibility you have to give BCG in the left upper arm. You have to also give JE in the left upper arm. So both the vaccine you are giving, so just maintain the distance between the two injection sites should be at least 1 inch apart. Okay, so all the due vaccines based. So what is helping us to answer the question? So you know the due age, you know the upper limit. Based on that, you are trying to figure out what are the vaccines which can be given to the child. Okay, let's take the next question. Now, if a child has never been vaccinated, again the child is not vaccinated, brought after completing 12 months. So he has completed 1 year. Now, for example, he is 13-month-old child. So what vaccine would you give? Again, the process is same. Start with BCG. Can you give BCG? I will say no, because BCG is given till 1 year. Can you give hepatitis B? No, it is given till 24 hours. Can you give rotavirus vaccines? No, it is given till 1 year. Penta 1 year, PCV 1 year, IPV 1 year. All these vaccines are not given because it is given till 1 year. Now the child has come at 13 months, meaning more than 1 year of age. Now, so what are the vaccines to be given then? So we will start routine doses of DPT, first dose, along with OPV, first dose. Right? Now DPT, we know the upper limit is till maximum till 7 years we can give. OPV till 5 years. Right? Now DPT is a part of pentavalent vaccine. So it is given till 1 year. Now since the child has crossed 1 year, so we cannot give pentavalent, but we'll start DPT doses. The first dose we have given at 13 months in this example. The next dose at 14 months, after 4 weeks, we'll give second dose of DPT, OPV, and in 15 months, the third doses. Means 3 doses of DPT and OPV, first, second, third will be given after 1 month gap. In addition to DPT and OPV, we will, since the child is 13-month-old, we can give measles rubella first dose, because measles rubella is given till 5 years. We can give JE first dose if applicable, because it is given till 15 years. And you can also give vitamin A, because vitamin A is given till 5 years. The only catch in vitamin A is since the child is more than 1 year, so you need to give 2 ml of vitamin A. Now you see, you have given DPT1, you have given OP1, you are giving MR1, you are giving JE1, and you are also giving vitamin A. The gap between the subsequent doses, gap between DPT and OPV should be 1 month. You can give 3 doses of DPT. Okay, let's take the next question. Again, what all vaccines should be given if the child comes in between 1 to 5 years? So all those vaccines which is given till 1 year, the upper limit, will not be given, which is BCG, hepatitis B, Rota, Penta, PCV, IPV will not be given. We will start with DPT 3 doses, first, second, third, after a gap of 1 month. We'll give OPV 3 doses, 1, 2, 3, after a gap of 1 month, along with measles rubella first, JE first, and vitamin A dose, right? This is given. Now you have to remember a few points here. When you complete 3 doses of DPT and OPV, the DPT booster, first booster, and OPV booster, which is given at 16 to 24 months. So the gap between DPT third and oblique OPV third and DPT first booster and OPV booster should be 6 months. Please remember, right? Okay, the second thing, the gap between vitamin A 6-month gap we maintain. The gap between measles rubella first dose and measles rubella second dose should be at least 4 weeks. The gap between JE first dose and JE second should be at least 3 months. So these are the 3 points which you should remember. The gap between DPT third and DPT third oblique OPV third and DPT first booster and OPV booster is 6 months. The gap between measles rubella first dose, measles rubella second dose, it is 1 month, and the gap between JE first dose and JE second dose will be 3 months. And you know the upper limit of all the vaccines. For DPT it is 7 years, for OPV it is 5 years, for JE it is 15 years, for measles rubella it is 5 years, and vitamin A it is 5 years. Okay. The next question is why DPT, hepatitis B, pentavalent, and now PCV also is given in anterolateral mid-thigh and not in the gluteal region? The answer is very simple, just to prevent the damage of sciatic nerve. And second, in children, in infants, you have more fat in the gluteal region. So vaccine deposited in these fats, if you're giving vaccine in gluteal region, will not generate an adequate immune response in the child. So it is better to give in anterolateral part of mid-thigh, either left or right, depending upon the type of vaccine. For pentavalent, if you are talking, or hepatitis B, it is in left, and for PCV, it is in right, to maintain the uniformity. Okay. Which vaccines can be given to a child between 5 to 7 years of age who has never been vaccinated? In between 5 to 7 years, the only one vaccine which you can give is DPT. Now, suppose a child come at let's take 5.6 month, 5 years 6 month. So you will give DPT first. You will give after a gap of 4 weeks DPT second, then 4 weeks DPT third, and between third and first booster you need 6 month gap, and from first to second booster you can give 6 month gap. So you can give DPT till 7 years of age. So DPT 1, 2, 3 at 1 month interval, and booster doses can be given after 6 months. Right. So any child who comes in between 5 to 7 years never been vaccinated, the only vaccine which you can give is DPT, first, second, third at a gap of 4 weeks, and the third and the boosters, the gap should be 6 months. Okay. Now, there is also a question, how long a bottle of vitamin A used once opened? So once you opened a vitamin A, you need to write the date, right, on the bottle, because it needs to be used within 8 weeks. So within 8 weeks of opening the bottle, if you have written the date, so you can calculate the 8 week, until 8 week you can use the vitamin A bottle. It should be kept away from sunlight. Now, next question is, people ask why BCG is given till 1 year of age, why not after that? So the program has been designed in such a way so the maximum benefit can be taken. So if you have not given a BCG vaccine till 1 year, so by that time the child may have natural clinical or subclinical TB infection, right? And this can protect the child from tuberculosis, the childhood tuberculosis. So there is no benefit of giving a BCG if the child has crossed 1 year, because the natural clinical or subclinical infection is the possibility is very high that a child will have clinical or subclinical TB infection. So there is no much benefit of giving BCG after the age of 1 year. Now, if no scars appear after giving BCG, should one revaccinate the child? The answer is no. You don't need to revaccinate the child just because the scar is not there. Okay. Why the dose of BCG is 0.05 ml in a child less than 1 month of age? You know, students, that in BCG the birth dose, and from birth till 1 month, and from 1 month to 1 year. So the dose between birth to 1 month is 0.05 ml, and 1 month to 1 year is 0.1 ml. So why are we giving 0.05 in this age group? This is the question. The question is because the skin of the newborns basically is very thin. So if you're giving a dose of 0.1 ml, there is a possibility that it may penetrate into deeper tissues and may cause abscess and axillary lymph node enlargement can be there. So we avoid giving that and we give half of 0.1 ml, which is 0.05 ml. Okay. Now, why birth dose of hepatitis B vaccine is given within 24 hours of birth? Because the vaccine is most effective in preventing perinatal transmission of hepatitis B only if given within first 24 hours. So you need to give vaccine within first 24 hours to prevent the perinatal transmission of hepatitis B. Okay. Now, what vaccine will be given to a child who has received at least one dose of pentavalent vaccine before his or her first birthday? Means before 1 year, before first birthday, the child has received one dose of pentavalent. So what you need to do? Now, the golden rule here, I'll tell you, because this will be seen frequently. If you have started a vaccine, a dose of vaccine, please complete it. Right? Now, the child has already taken Penta 1. Now the child did not turn up. The child has celebrated his first birthday. Right? Now what to do? So we know pentavalent should not be given after 1 year of age. The upper limit is 1 year. But in this case, the child has already received Penta 1 before 1 year. Now what should we do? Now, as I said, once you have started a vaccine, please complete its doses. So you have already started with Penta 1. No matter the age has crossed 1 year, please complete with Penta 2 and 3. Right? So what will help us in answering such questions? Once you have started the dose, complete it. Okay. Let's take next. After introduction of pentavalent vaccine, will DPT and hepatitis B be required? Yes. Hepatitis B is already we are giving it at birth, and DPT also we are giving as first booster in 16 to 24 months and second booster as in 5 to 6 years. Plus, in the past questions you have seen, if a child comes after 1 year of age, has not taken any vaccine, so we give routine DPT 3 doses plus the routine boosters, right? So DPT and hepatitis B will be required and it is used. Okay. What is the maximum age limit of giving first dose of rotavirus vaccine? So you know the upper limit of rotavirus vaccine is 1 year. So you can give the vaccine till 1 year. Any dose the child has taken before 1 year and the child has crossed also 1 year after that, and then the child comes for the next scheduled dose, you need to complete the dose, because as I said, once you started a vaccination, you need to complete the doses. Okay. Yeah. So let's take the next question. The next question says, what should be done if a child has received 1 or 2 doses of rotavirus vaccine in private facility? Now, if any beneficiary has taken rotavirus vaccine in private facility and then come back to a public facility and says that I want to complete my doses, so what is the golden rule? The golden rule is, let's treat that beneficiary as a new beneficiary and follow the national immunization schedule. And what is the national immunization schedule? If the child is less than 1 year of age, we'll give 3 doses of rotavirus vaccine less than 1 year of age. Right? So no matter the child has taken in private, but we'll treat that beneficiary as a new beneficiary and will vaccinate as per the national immunization schedule all the doses. Okay. Let's take the next question. How should you vaccinate if a child has not received IPV vaccine at 6th week? Now IPV, fractional IPV, it is given at 6th and 14 weeks. We know that, right? And maximum age is 1 year. Suppose the child has not been vaccinated at 6 weeks. So before 1 year, if the child comes, you can vaccinate it. And the second dose, the gap between first and second dose should be 8 weeks. You know, 6 weeks and 14 weeks, the gap is 8. So let's maintain a gap of 8 weeks between first and second dose. Okay, let's take the next question. Does a child need to be vaccinated if she or he has history of any fever, rash, illness, including measles, rubella? The answer is yes. You need to vaccinate the child even if the child has suffered from fever with rashes. Can be a case of measles or rubella. The child need to be vaccinated at the recommended age. Okay. Now, if a child has received measles rubella vaccine before 9 months of age, is it necessary to repeat the vaccine later? The answer is yes. We will stick to NIS, National Immunization Schedule, which in the case of measles rubella, it is 9 to 12 months the first dose and 16 to 24 months the second dose. This is the first one, this is the second one. So we'll stick with this even if the child has received in emergency in before 9 months of age, but we'll stick to the NIS. Okay. Now, if a child comes after 2 years of first dose of MR, then can she get the second dose? The answer is yes. Why? Because measles rubella is given till 5 years. You know this. So the first dose was taken at 9 months, and the child comes after at 3 years. 9 months first dose you are given, and then the child comes at 3 years. You need to give the second dose. Right? If the child comes after 2 years, has not taken any vaccine, you can give measles rubella first dose and second dose, and the gap between first and second dose needs to be at least 4 weeks in addition to the other vaccines which we can give. So students, by this time you will, by taking all these questions, it is clear what is helping me to answer these questions, or what will help us to answer the question. The best thing is the due age, the maximum age, and the possibilities, and that helps to answer the questions. Okay, let's take the next question. If the child has received all vaccines as per NIS, does she or he need to vaccinate during supplementary MR campaign? The answer is yes. The moment the word comes supplementary, so it cannot replace routine. So routine immunization schedule as per National Immunization Schedule, the routine doses, if the child has taken, if the government is doing a campaign, that will be only a supplementary dose. So yes, the child can take that supplementary dose. Okay. As measles and JE vaccine dose are recommended for same age group, can they be given together? Yes, they can be given together because MR first dose, you remember the dose is 0.5 ml subcutaneous in right upper arm, right? JE first dose, same subcutaneous, but you're giving left upper arm. So what's the problem? Give it, right? There is no issue in giving it. If the child more than 9 months but less than 24 months who has never been received any JE vaccine comes for immunization, how should JE vaccine be administered? So the child is in between 9 to 24 months. Let's take 14 months. The child comes. So what will you do? You will give JE first dose. Why? Because JE is given at 9 to 12 months. The upper limit is 15 years. So you can give JE first dose, and then maintain a gap of 3 months, and then you can give JE 17 months. So we have the scheduled dose of second dose of JE is 16 to 24 months. So you can give at 17 months the JE second dose. Okay. Now, what should be done if a PCV dose is delayed? Now, for PCV students, we know there are 2 routine doses, right, which is at 6 weeks and 14 weeks, and there is 1 booster at 9 months, right? Now, if the doses are delayed, the question is, if the doses are delayed, you need to, and if it is less than 1 year and the doses are delayed, you need to give the vaccines. The only thing you have to remember, the gap between 2 doses should be 2 months, right? And once you have started the vaccination, and even if you have given first dose, for example, at 6 months, the child come after 14 months, then at the age of 14 months, you need to give the second dose of PCV followed by a booster, because you have started it, so you need to complete at the earliest available opportunity. Okay. Okay, can only 2 PCV dose be given? No. So we are giving 2 routine doses along with a booster dose because it helps in protecting against pneumococcal colonization, and it is, the benefit of booster dose is not only that the immunity against pneumococcal disease, but it also reduces the carriage, which is having an indirect benefit on the community members. Okay, now what all this few questions which I have taken, the peculiar situation, the eccentric situation which our health workers faces in the field, the child coming at different age group, not coming on the right time at the due age. So the knowledge of due age, the knowledge of upper limit, followed by having experience of these questions which we have taken, will definitely help us to vaccinate child as per the national immunization schedule. So I hope you must have liked this frequently asked questions. Thank you very much for watching my video. If you like the video, please subscribe my channel. I'll be trying my level best to come up with more videos which will elucidate the different topics in community medicine. Thank you very much. Take care. Bye bye.